You have pain with penetrative intercourse and you don't know how to talk about it with your partner. I have some tips for you. Number 1, if pain is more than pleasure during sex, if it's actually more painful than it is enjoyable, stop. Your body actually remembers pain. So it's called implicit memory, and your mind cannot just be like, okay, this time it's gonna be good, let's relax and have fun. Because your body and your pelvic floor will tense up and close and you'll continue to feel pain. There are many different reasons for pain with intercourse, so it's not a one-size-fits-all, but there's many things that you can try. Use lubrication every single time. I would recommend using a water-based lubricant because it absorbs into the skin and you'll have less chances of infection. You just might have to reapply it. If you have pain with deeper penetration, try different positions, and it'll probably be most comfortable if the woman is in charge of how fast and how deep the penetration is. You can also buy something online to put around the penis to prevent the penetration from going as deep, and it still feels just as good for both partners. And talk to your partner about what you really need before penetration, what your wants are, what your desires are, what your preferences are. And if you don't know what those are, ask your partner if they would be open to exploring different types of foreplay. Foreplay can be anything from cuddling and kissing to oral sex to touching, and there's honestly so many different options, so just be open and ask your partner if they're open to exploring. And foreplay is so important for a woman before penetration. Men are typically ready to go within 5 to 10 seconds, but a woman's body actually has to send blood flow and lubrication and get all those nerves around the clitoris and vagina sensitive so that you can enjoy the penetration. Foreplay should be at least 10 minutes, more if possible. You'll know you've done enough foreplay when you're basically begging for penetration by the time it happens. And if you're not intimate with your partner outside of the bedroom, it's going to be that much harder to be intimate and present with your partner inside of the bedroom. So talk to your partner about your day, be honest about what you're feeling, about what you're worried about, and get the same from them so that you can enjoy intimacy more inside of the bedroom. And when it comes to talking about sex, it can be really vulnerable to do it in the moment. So ask your partner if they have time during the day, maybe when you're doing an activity together where you can talk about sex. So it doesn't seem like you're blaming or pointing fingers or putting a lot of pressure on your partner. And lastly, get the health of your pelvic floor assessed. So if these techniques are not enough and you're still having pain with intercourse, it's likely that your pelvic floor is too tense, maybe it's too dry, maybe it's too sensitive. And in pelvic floor therapy, we can figure out which layer of the pelvic floor we need to treat, or maybe all 3 layers. We can give you an individualized program to help your pelvic floor relax and to have you enjoy intimacy with your partner like sex is meant to be enjoyed.